Hey friends, we're off here again with the Louisville Proactivist Report. Thank you so much for joining me today. Back with another interview. It's a big weekend ahead. Coming up here on the 24th is the Medicare for All March. This is taking place in at least 24 cities. It's up to 52 different marches now. And of course we have one here in Louisville. That's going to be at 11 o'clock. So we'll get into that here in just a moment. But share this out. Share this out to anybody you know that needs information on Medicare for All. We're going to go through it. Talk about everything from the march, what Medicare for All is, and break it all down for you. So my guest today is chair for Kentuckians for Single Payer.
Yes.
And her name is Tillow, and she is the organizer of this march. So I'm very honored to have her here today. So let me get her on camera for you all. There she is. Say hi to Kay, everybody. How are you today, Kay? Thanks so much for joining me.
I'm doing great. I'm really happy to be with you, and thank you for doing this.
All right. So, like I said, we had this march coming up Saturday. What drew you to this march? What draws you to Medicare for All in general? What got you involved and passionate about this topic?
Well, I've been doing this for a very long time. My background is that I worked in the union movement for all of my life, and I worked mostly with nurses and hospital workers in organizing. So I was around the problems of our healthcare system and become conscious of all of the problems, particularly of the role that profits play in making our healthcare system one that doesn't work for the patients and doesn't work for the nurses and other people.
That's right. So like I mentioned, you're chair for Kentuckians for Single Payer Healthcare. How did you get involved with that? How did that group come about?
Well, I'll just start with 2004. It really goes all the way back to the early 90s when we began working on it here in Kentucky. But let me start with the founding of Kentuckians for Single Payer Healthcare was in 2004. And it was after Congressman John Conyers had introduced the national single payer legislation. That was H.R. 676. That was introduced in 2003. And so we formed our organization to work to mobilize people, to work to make that pass, because we believe that it takes a legislative solution. It's not something that we can make happen without the Congress acting on it. So we've been a local organization since 2004, and we currently meet twice a month, recently by internet, but before that at the downtown library. And we have a group of activists we're all volunteers. We have no staff. And we're a nonprofit organization. We are affiliated with Physicians for a National Health Program, which is the national organization that published the plan. How would a single payer plan work, on which the legislation that Conyers introduced was based. And basically, the analysis that we have, and it's really true, is that what's wrong with our system is that there are profit makers inside the system that are siphoning off the money that we need for the care. They're making it very, very, very expensive for people, and they are putting barriers in the way of people getting health care. So we're working to remove the insurance companies from the control of our system so that the money that we have can all go to care. We can remove the barriers so that there are no copays, no deductibles, nothing in the way of people going to their physician or going for whatever care that they need. So it's the plan that we have to go to. Others propose shorter range things or smaller steps. But none of those smaller steps are going to do it. We've got to cover everybody.
Right.
And not only do we have to cover them, we have to include more things than they're covered for now, and we have to remove all of the things that are in the way, which is deductibles and copays and those things, pre-authorization, a million things that the insurance industry has thrown in the path because their analysis is that people are overusing the healthcare system. So when they can deny care or keep someone from using the care because it's too expensive, they make more money. That's a problem. We have within our system this contradiction of those who are controlling it having an interest different from those of the patients. So we want a system that's publicly funded and available to everyone, free at the point of service, so that no one gets left out or says, I can't go because the copay is $50 or anyway. We want it to be freely available to everyone, and other industrialized countries have done this, and it is criminal that our nation is so far behind, and we're trying to catch up.
Totally agreed. So let me ask you this. I know some people that don't know too much about it, their question is, we can't afford Medicare for all. Now, I get the concern, but that's not how it really goes. It's actually cheaper in the long run for this country. So can you kind of talk about, how do we afford this and how would it work?
Sure. Well, the truth is we can't afford not to go to a single payer plan, because the plan that we have now is the most expensive in the world. Our nation spends about 11 or 12,000 per capita per year on health care. And the average of the other industrialized countries is probably around 5,000 or 6,000 per capita per year. And they have greater lifespans, they have coverage for everyone, so we don't have good outcomes, and we're spending double. So why would we keep it the way it is? And that's why, a single payer plan or an improved Medicare for all would indeed reduce the amount of money that goes to wasteful administrative costs and to those mechanisms that make it profitable, and would use the money instead to bring care to everybody and to expand care for those who are now covered. Because, now we have the problem not just of the uninsured. There are about 30 million uninsured, give or take. It's probably higher than that because no one's been able to really count how many people have lost their coverage in the pandemic. So we really don't know, but it's at least 30 million that don't have any coverage. But that's not the half of it, because the people who are now covered don't have coverage good enough to use it. I mean, it's just a horror. If you have $1,000 deductible and your kid is sick, do you go to the ER and ruin the family budget, or do you chance it? Well, people are making those terrible decisions and denying themselves care because of the copays, the deductibles, and the things that, the pre-authorizations, all of the difficulties that are put in the path of people who are seeking care. So we have to change all of that. That's the people who are called underinsured. They nominally have coverage, but they can't use it, so it's many, many, many millions of people. I think I saw recently that about a third of our people either delay care, go without drugs they need, or go without care completely because of cost. A third of the people report that. I mean, a third of the people is what, 110 million?
Right.
That's like how many people can't get the care that we need. And you know, it would be different if we were a poor nation, we didn't have the ability, we were struggling to be able to have enough money to produce medicines or to have hospitals. We're the wealthiest nation in the world, and we do the worst job of industrialized nations in taking care of our people. So that's why improve Medicare for all. That's why on Saturday we're going to have a rally and a march in downtown Louisville. We're going to start at in front of the Mazzoli building. That's the Mazzoli Federal Building. Its address is 600 Dr. Martin Luther King Jr. Place. But that really is a kind of a small street. There's a big park in front of the Mazzoli building. So we'll be in that park, and we'll be near the corner of 7th and Chestnut, where there's shade trees. So that we want our speakers and all of our participants not to get overheated. We're really for health. So we invite people to join us at 11 o'clock near 7th and Chestnut in front of the Mazzoli Federal Building, and we'll have some speakers and some music. And we're starting at 11, and then at noon we plan to, well, we say march, but we're probably going to walk. I don't think in the July heat we're going to be high stepping to get there, but we're going to walk on 7th and north to Liberty and to Breway, or it's also called Injustice Square Park. It's where the demonstrations supporting Breonna Taylor were. And there we are going to lay flowers in memory of Breonna Taylor. And we're going to recognize that she had chosen to be a healer. She had chosen to be an emergency room technician and was on the path to being a registered nurse. And we want to connect with her and with that movement that seeks to end structural racism. So we will be at the square there with the flowers, and following that we will return to, on 6th, we'll go back to where we started, to in front of the Mazzoli Federal Building, and we'll have some refreshments and socialize, and I think we'll also have a birthday cake. You know, we're celebrating the 56th birthday of Medicare. And I don't know if your listeners know, but Medicare is our best program. It is one that is publicly funded, and it covers people who are 65 and older. It also covers people who are totally disabled. If they've been disabled for 2 years, why should they wait? But and it also covers people who need dialysis. It's the best program that we have, but of course it's under threat because it's being privatized as we speak, and there are private insurance companies that are selling Medicare Advantage, and the program is being undermined. But we want to celebrate Medicare because it is the structure of what we need to be inclusive and everybody's in. Of course, Medicare needs to be improved. It doesn't cover dental and eyeglasses and other things, and it doesn't cover long-term care, and it has too many copays, and it doesn't really cover drugs. So all of those things would be in an improved Medicare for all. That's why we say the improved, because we want that to be a part of it. But Medicare I think when it was passed in 1965, it was implemented within 10 months, even though there were no computers at that time. And it was quickly implemented, and because it just changed the payment. And so we think that that's the kind of model for what we want. We want it to happen quickly. The payment would change to the public payment for Medicare. One of the things that many people are not aware is that when Medicare was enacted in '65, we had many hospitals that were segregated. And that program had within it that no hospital could get any money from this program if it was segregated, if it did not treat people equally. And it was the power of that federal Medicare program that integrated hospitals across the South when they couldn't collect the money. So it shows that there is the ability for a federal program to do a world of good, to get us beyond, the things that have been wrong in our country. So we're going to have birthday cake when we get back. We're going to celebrate Medicare's 56th birthday, and we're going to pledge that we're going to improve Medicare, we're going to expand it to everybody, and we are not going to stop until we get national legislation that will implement a plan that covers all of the people.
Now, what can just the average person do to help make this happen? Is it just contacting your legislators, just showing up for these marches? What are some of the options?
Oh, there are many things to do. If you want to join with our group, we'd be glad to have you. You can reach us. We have a website at kyhealthcare.org, and we have a Facebook page, Kentuckians for Single Payer Healthcare, and we would love to have you come and be a part of it. But there's so much to do. One is to help to educate your family and friends, because they need to know why. Why is it we can't just throw a little more money at it and that'll cover everybody? And that's because the money isn't going to care. So much of it, about 30%, goes to administrative things, including quite a bit of waste. For instance, the insurance companies take something anywhere from about 15 to 20% that doesn't go to care of what goes to the insurers, the Medicare Advantage plans. Medicare uses only about 2% to administer it. So there's so much savings that we can get when we go to a publicly financed program that's made available to everybody. People can write letters to the editor. People can help us to distribute leaflets. People can come to the rally on Saturday. They could join us in our meetings. We meet the first and third Thursdays of every month at 5 p.m. And we're going to begin going back to in-person meetings on August 5. So if you want to come to the downtown library, it's at 301 York. We meet in the boardroom at 5 o'clock on Thursday, August 5th. So you're welcome to come there. But please come to the rally, because it'll be a good time, and we'll have, we have 18 organizations that are co-sponsoring this. I think that shows the extent to which there is really a clamoring, a desire that's deep to solve this problem. The organizations include the Kentucky Alliance for Retired Americans, the Kentucky Alliance Against Racist and Political Repression, and I shouldn't have started naming them because I'm going to leave somebody out. Fairness, Louisville Showing Up for Racial Justice, the Physicians for a National Health Program of Kentucky, And I can't name them all, but if you want to see them, you can go to our website and they are there.
Yeah, so it is a very long list. So thanks to all of those organizations for being involved in that. So is there anything else you think people need to know about Medicare for All that we haven't talked about so far?
I think people need to know that the people are going to have to make the enactment possible. You know, we now have a majority of the people who are for it. And you would think in a democracy, when a majority is for something and it's good for the nation, then the people's elected representatives would vote that in and enact it. But that's not happening. There's an impediment in the way. And the influence of the pharmaceutical companies, the insurance companies, and all of the others, for-profit companies, private equity firms that are buying up physician practices, for all of those people, healthcare isn't a good and a service and a kindness and caring for people. It's a way to make money. And all of that money is in the way. And some of that money goes to politicians. So we have to build a movement that is more powerful than that money that is speaking too loudly right now. So that's a part of the reason why we're going to take to the streets in 52 cities to try to uplift that voice, because it is possible in our nation to make things happen, but it is not easy to get a really good reform. So it's going to take activism by everybody in your audience, as many people as we can bring into this fight. I did want to mention that our organization offers free programs to explain single-payer health care. We have films, we have PowerPoint presentations, we have things that help people to really understand. You know, you have to know that we're behind. We live 4 years shorter than people in Italy. We're not doing well. Our life expectancy is going down.
Right.
It's a disgrace to our country, and it is a suffering that doesn't have to happen. So we call on people to lift your voice. And I'm sure people have ideas that we haven't thought of, but we can make presentations by Zoom, or we can make them in church basements or union halls or clubs or parks or anywhere. You know, we would be glad to do a presentation for your group to help them to understand it. And then when people understand that this is the step we have to take to solve the problem, then we're going to finally make politically possible what has not been possible up till now.
It's very well stated. So people can get information on that at your website?
Yes, they can. It's kyhealthcare.org.
All right, any last thoughts or anything?
Come to the rally and march on Saturday, July 24, 11 a.m. Excuse me.
11 to 2 Saturday, Dr. Martin Luther King Place, 600 Dr. Martin Luther King Place. And we'll be marching to Breeway and back. There will be speakers, there will be birthday cake, all the good things. Thank you so much for coming on today, Kay.
Thank you, Rolf.
I'm gonna do myself a quick little rant on this.
I just lost my voice. I don't know what happened to it.
That's okay, it's good timing though, 'cause we got through it.
Oh, well, I hope I didn't talk too much.
Oh, absolutely not.
I rambled a lot.
That's quite all right. So yeah, this we're really excited to have Kay on today. Medicare for All is a big deal for me. Obviously, with this show being more local, I don't get to talk about it that much. But I am very passionate about this. I think it's one of our most important issues. We are the richest country in the world, and every year we have up to 68,000 people die due to a lack of healthcare access. As low as 27,000, I believe. That's, you know, one person is too many in the richest country in history. Healthcare is a human right, Everybody deserves to have access to health care. Everybody deserves to be healthy, and you know, that's part of a happy life, a successful life. I know this hits home for a lot of people, especially now during the pandemic. It's really shine a light on this, if it didn't before. And even before, we looked at some of the studies. There was one, I believe, in 2004 that showed U.S. had dropped to 37th in world health care. There was another one, I believe it was in 2011, if I'm not mistaken, that showed us it was just first world countries, and we were 11th out of 11, so last place in that study. How do we do that? Being the richest country, it's just inexcusable. Now we've had this pandemic. People lost their jobs due to no fault of their own, due to the virus, and they lost their health care coverage that came with their jobs. So you're putting people out of work with no health care during a pandemic. It's past time to end this system of health care through the workplace. Every citizen should have it. Everybody should get improved Medicare for all. That's what our tax dollars should be going to, not endless wars, not Wall Street bailouts, but actually working for the people, keeping our populace healthy. That's where the priority should be. So it is time. So share this video out with everybody. Of course, if you can't make the march, please make the march. But if you can't make the march, I will be live streaming the march. So share that out to anybody who can't make it. It's very important. You know, call your legislators, email, I can't even spit it out. Email your legislators, even tweet at your legislators. You know, put the pressure on. This is not a bipartisan issue. You know, the popularity has skyrocketed across the board. I saw a Fox poll where even 52% of Fox viewers support this now. So, you know, the battle has been won as far as public opinion. It's time to get our legislators on board. So let's take to the streets. Let's apply the pressure. Let's do what we have to do. Share this out. Talk to your family about it. So, yeah, that was my little rant. So yeah, I will be live around 11 o'clock on Saturday. Friday is my next interview. Look for that around 5 o'clock in the afternoon. I'm having Samantha Franklin on. She is a disability rights activist here in Louisville, and we're going to talk about disability issues here in town. So look for that on Friday. March on Saturday. I'm lining up some more interviews for next week and the week after. So just stay posted, and I'll get those out as soon as I can. Thank you all for watching. Share this out. Smash all those appropriate buttons. You know what to do. Like, comment, share, click the follow, click the heart buttons, all those good buttons. Thanks everyone. Until next time, remember, always think critically.